Hello, everyone, and thank you for joining. We're very happy to have you all with us today. My name is Ben Pinkerton. I'm Director of Product Marketing for Vidyo, and we're super excited to take you through a session today with the folks from Level Therapy. They're going to be talking to us about their service and how they've solved a unique problem and explain to us how they're using Vidyo.io as part of that service. We're super excited to have them with us today. Before we jump in, I just wanted to point out a couple of logistics for everyone. If you look in the webinar tool, you'll see there is a tab at the top there that says handouts, where you can actually get access to some handouts we've provided, which are the slides from today and a listing for an upcoming webinar that we have. And we also are hoping that you'll ask questions. So there's a Q&A tool where you can submit your questions. We ask that you feel free to submit your questions at any point during the webinar. And then after we've gone through the presentation, we'll do our best to address all those questions in the time that we have allotted. With that, I want to take it and hand it off to the team at Level Therapy with Dan Miller, the CEO, and Coley Williams, the Chief Medical Officer as well. So Dan, Coley.
Thanks, Ben.
Thank you, Ben. All right. Hello, thank you for joining us today. We're going to talk to you a bit about the Level Therapy story and what we're on a mission to do. So Level Therapy is an app that we've built to address the mental health problem in the United States. And our mission is to really empower every person on earth to democratize by democratizing mental fitness. So one thing we've noticed along the way is that we need to take a proactive approach to mental health, and that means creating a whole new category of treatment that we're describing as mental fitness. So Dan and I came together 2 years ago to found Level Therapy. My background is in psychology and therapy. I'm a licensed marriage and family therapist, practiced in California, and taught at the master's level in both Mexico City and in the United States.
And I have been in tech for about 9 years now. And so I've worked for companies like SurveyMonkey, Salesforce, Forrester Research. I've launched a company previously, and we came together about 2 years ago after experiencing both pain points on both sides of the market. So Coley as a therapist and growing a practice, and myself as a patient when I was looking for a therapist and having a very off-putting experience.
So let's take a second and really look at the state of mental health as we know it right now. So we know that in the United States alone, about 43.7 million people are diagnosed every year with a mental health issue. And it's important to keep in mind that those who are diagnosed are those who've actually navigated the healthcare system to the point of diagnosis. Now, while that's a pretty astounding number, beyond that, we know that 60% never seek treatment. And the other piece that we know about this from a business perspective is that mental illness goes untreated, costs the United States $193 billion a year. And so as Dan and I came together to really understand and dig into this problem, it was really obvious pretty early on that there's three major reasons that people do not get access to mental health treatment. And those are stigma, access, things like geography, and the cost. So we came together to found Level Therapy, which really addresses all three of those issues.
And so, building a mental health practice offline is very challenging, and building one online is even more challenging. And so we have to manage things like HIPAA compliance and accessing patients at the right time through the right methods while building a brand really consumer friendly and engaging, and making sure that people that use the app have an amazing experience. And so when we started to dig into the partners that we would need to build this type of infrastructure, at the top of the list was making sure that we found an amazing partner to allow us to have HIPAA compliant video chat so that we could actually provide convenient access to our therapists. And so after doing a lot of research, we deduced that that actually ended up being video as the best solution for us. They were by far the easiest partner that we researched that allowed us to build a solution very, very quickly, which you can imagine in a technology company is really, really important. And ultimately happens to be a competitive advantage for companies is how quickly we can iterate and build. So that was a huge plus. Also, they allowed us to be HIPAA compliant. I mentioned is a very, very important thing for not only just level therapy, but just for the digital health industry at large. And so we take privacy very seriously, and the privacy of our patients is definitely paramount to everything we do. And so we make sure that we find vendors that have that same viewpoint within privacy and trust as well. And so after my experience of using a competitor and having a very off-putting experience, I knew that we need to build a very user-friendly application. And initially, a lot of the companies that were in the market were web-based, and so people had to be attached to the internet, thus they had to be attached to most likely a room and not in a space that was really convenient for them. And so the sole option for patients to access treatment is through their mobile phones. And the goal there is to make sure that they're in a space that they're comfortable in. Secondly, we focused on making sure that we are finding the right clinician for the right patient. And so whereas the rest of our competitors and the rest of the industry, even offline, people will find therapists either through referrals or recommendations from friends, or most likely they just found one in a directory and just picked one because they didn't know how to discern who was the right person or who was the wrong person for them. And so we focused on making sure that we were finding the right clinician for the right patient. And how we do that is by asking 4 to 7 questions to get a sense of what the patient is, as well as if they have any preferences for the type of clinician they like to work with. So we've noticed that that has ended up being extremely important in creating a sticky product for our patients. And so for people that end up actually booking through to an actual session, they tend to be stickier and we see less churn than there exists offline. So we know that we're doing something right there. Lastly, we have some self-paced action-oriented programs, specifically around anxiety and depression. And so these are some products within the app that allow patients to go at their own pace and on their own versus working with a professional to work on managing anxiety and depression. So we have clinically validated assessment tools within the app so people can check in every 2 weeks to get a sense of how well they're progressing within treatment, as well as mood trackers and these actual programs within the app that allow them to progress at their own pace. Anything you want to add?
Yeah, so also to talk a little bit more about that a couple of things. This new piece of product that Dan's talking about, the self-paced action-oriented programs. One thing that we recognize is that our hypothesis worked a little better than we'd intended. And so as a therapist, I found over and over again in a traditional practice that clients often call because they know that something needs to change, but that doesn't necessarily translate to immediate action with the therapist. It's a pretty scary thing in the beginning. And so what we did is really talk to our users, do some focus groups, and understand that there needs to be a bridge between actually seeing a therapist for the very first time and getting a better understanding of what's happening for you and what your options are. So based on that information, we've designed this program to really help people bridge to the type of support that they need. And so that's a really, it's a pretty revolutionary approach. It's all based in evidence-based practices, but it really meets the client where they are and supports them through full treatment with an actual individual therapist, or may just help to contain them and give them new skills to move in the world.
Exactly. And that's where the mental fitness piece comes in. And so this isn't just a solution-based product where we're just providing access to therapists. That's not new. That's not anything that hasn't been done before. What we're aiming to do is get at the root cause of issues before people are experiencing severe clinically diagnosable disorders. And so that's where these self-paced programs come in. And so here's what we built. And so we spoke a little bit about the matching algorithm as well as the HIPAA compliant video platform, but here is a little taste of the application and kind of what the user experience looks like. And so as I mentioned, the very first touch point for anyone that wants to speak to a therapist is an actual chat with one of our intake specialists to get a sense of what they're experiencing, as well as if they have any preferences. Additionally, we have access to amazing long-form content that we have within the app that's also available on healthline.com, which is a very large healthcare news aggregator that we partnered with. We produce all of this in-house, so it's focused specifically on disorders that we see our patients experiencing. And so if an individual is ready to book with us, we provide them a free 20-minute consultation after we recommend 3 clinicians in our practice. And so we use the answers from those 4 to 7 questions to recommend 3 clinicians. And these are based off the preferences that they let us know, as well as the specialties that our clinicians have. And after those 3 are sent to the patient, they can choose one of those 3 to book a free 20-minute consultation. If they like that clinician, then they can continue to book with that individual. If not, they can move on and try another clinician within the 3 that we recommended. Or if we completely miss the mark, which hasn't happened yet, we can recommend others that are within the practice as well. And so here is how a little slide about how we stack up against some of the competitors that exist in our space. And so I mentioned we have access to the licensed clinicians, so we are a practice. We have coverage in 7 states currently. And we also provide access to these therapists through video. And so we do have chat built into the application. However, we've noticed from doing some market research that clinicians become overwhelmed very, very quickly from just access through chat. And we also know that empirically we can provide the treatment that research suggests we can through video and not through chat.
And I'll hop on that too. The other reason, something that we've looked at very closely is making sure that our therapists are well taken care of and that we're building a community of therapists that's very engaged in this work, as it's really a new way to work with. And so the other piece is that we take very seriously protecting our therapist license. And video platform we found is the best way to ensure that they're working within the scope and appropriately under their license.
Yeah. And I mentioned the matching algorithm. And so we focus on finding the right therapist for the right clinician and vice versa. And so clinicians that join our network, they are able to treat the patient population that they are really interested and specialize in treating. And that ends up being really, really positive for the therapeutic alliance, making sure that treatment outcomes are increased. I mentioned that we are a group practice. We do accept insurance through self-insured employers. And so self-insured employers need a couple of data points to submit a claim to their insurance underwriter for reimbursement. And as since we are a practice and our service is billable by insurance, we definitely can provide them with those 2 data points. Lastly, we have the self-paced self-help products. And so again, this is something that's really, really important because we've done the heavy lifting of building a practice and finding amazing vendors that allow us to have that infrastructure like video. And we also have executed on building amazing products within the app so people can go at their own pace and work on things instead of actually speaking with a therapist. And we've noticed during the research that is definitely an option that ended up not allowing us to service a lot of patients between now and when we launched last October.
And the other piece that the self-paced programs that we're releasing do is allows us to treat anyone in the United States. So or really anyone who's English speaking at this point. So that really opens up the market and those people who we can help impact.
And so with that, I would like to open it up to questions and send this back over to Ben. Lastly, I do want to let you all know that we are actually fundraising right now using the largest equity crowdfunding platform called Seed Invest. If anyone is interested in learning more, you can type in the link that you see on the screen, but otherwise we'll open it up for questions.
All right. Thanks, Coley. Dan, actually, before we take questions, I wanted to share with everyone a few slides on Vidyo.io.
Your screen sharing has been disconnected.
Do that next. But if you do have questions, please feel free to go ahead and submit those into the question and answer tool. And Dan, I'm going to ask if you guys can just mute your microphone.
Yes.
Thank you. So as Dan and Coley mentioned, the video component of their app is actually powered by the Vidyo.io platform. And for those of you that aren't familiar, Vidyo.io is a CPaaS, or a communication platform as a service. And unlike maybe other CPaaS platforms that you've looked at or have seen in the industry, we've taken a very razor-sharp focus on providing high-quality, scalable, multi-party video chat. So that's really our core area of expertise. It's something that Vidyo has been developing and refining over a decade now. And what we've done is we've taken this technology and this platform that we've been working on and are now providing that through the Vidyo.io offering as a set of easy-to-use APIs, so that other applications and services can integrate that video chat technology directly into their app. So one way you can think about Vidyo.io is a real-time communications network. Basically, the service provides everything that you would need for a video chat service, including things like firewall traversal, so that when users connect, if they're behind a challenging firewall scenario, they can get connected. They don't have to worry about complicated in-user steps in order to connect into the call. We have a globally distributed series of points of presence, so that anyone that's accessing the cloud, the Vidyo.io cloud or service, will get automatically routed and directed to the nearest connection point, so that they're assured the highest quality possible. Of course, it provides bridging for all the multi-party or group video chat services. So whether you have 2 people or 202 people or even more, you can actually build apps that leverage that multi-party capability and provide a great experience for those users. And of course, all of the expectancy and failover and things like that are built into the service that allows for a very resilient and reliable experience. Basically, this all translates into, for a developer or an application or service provider, is they don't need to worry about dealing with complicated video infrastructure or services. They basically can just leverage the SDK and focus on building a great app, and we handle all of the video complexities for them. And it's based upon some core technology that, as I mentioned earlier, Vidyo has developed over the course of more than 10 years. First of all, it's all based upon a core routing engine that basically manages all the video streams coming from the participants and delivers those out to all of the other participants in the call. And it does this in a very, very low latency manner. So this makes for a very natural conversational experience. So you can imagine when you're having, a consultative discussion, whether that's with, a clinician, a therapist, or even, with a customer that you're trying to have a discussion with, you want to have the highest quality experience possible without, delays or unnecessary sort of hiccups that might make the experience less than desirable. We also leverage a technique known as adaptive video layering, where we continuously optimize the video connection for each participant. This is particularly important over when users are connecting from unreliable networks, such as residential cable modem connections or Wi-Fi or wireless connections on their mobile devices. So the system constantly optimizes that connection, so you're always getting the best quality experience that your network and your device can provide. And we provide a very broad set of support for a variety of different endpoints, whether you're talking about a mobile app, a native desktop app, or an in-browser app leveraging like WebRTC technology. And so the folks at Level, they are building a mobile app, and they've been able to take advantage of some of the specific technology that we've built into our mobile SDK. First of all, we have a set of mobile optimized codecs. So we've actually engineered and developed our own codecs that are built into our SDK, and they've been specifically tuned to operate over mobile devices. One of the challenges you have, are very limited CPU resources on the mobile device. And so being able to strike that right balance of, best performance without trading off, unnecessary battery life and quality is a particularly challenging issue to deal with, and that's something that Vidyo has worked very hard at optimizing. We've been delivering a mobile video chat experience really since smartphones first had front-facing cameras. Another key element is dealing with the wireless networks. When you're talking about mobile, you're inherently talking about a wireless connection. And so with our technology, it constantly assesses the network connection and will adjust the video quality to match whatever that network connection can handle. So you're always getting the best experience possible, regardless of what the network is doing. It also is very error resilient. So we have a lot of error concealment and error resilient techniques that we apply to the video, so that as a user, even though you may not have the best network connection, you don't get a completely broken picture and broken experience. We try to preserve that consistent experience as much as possible. And then the other pieces to that are, having good resource management, so that you're making sure you're keeping track of, the CPU, available CPU, balancing the video quality, dealing with the resolution of the device. Some devices have higher resolution and lower resolution, so being able to optimize that video stream for that specific device is an important element as well. And then, when you're building a mobile app, you're building for a variety of different platforms potentially. So whether you're building for like an Android device that's ARM-based or ARM64, or even an Intel-based Android device, support for all of those different hardware platforms are built directly into that SDK. And it's not just a mobile platform. We support a variety of different platforms, whether it's in-browser based using WebRTC, or we have a plugin for IE and Safari. On the mobile side, we support iOS and Android, and on the desktop side, we support native apps for Mac OS and Windows. But the really nice thing about that is the APIs across these different platforms are very consistent. So once you develop for one platform, it's very, very easy to migrate over and to start building for the next platform. You've already learned how the API behavior and so forth, so it makes it very, very easy to add support for those other types of platforms that you want to support. And it really shortens your time to market. And the service itself is very, very secure. We secure the signaling and media on the platform. We use AES 256-bit encryption. In the video platform itself, we don't handle any patient PHI or anything like that. So you don't have to worry about that information or any privacy there. And it's really a platform that's designed to support HIPAA-compliant apps, so that you can rest assured when you're using Vidyo.io for telehealth applications, you're going to be in a secure environment. Okay, so with that, I'll just throw in my shameless plug here. So any developers in the audience that maybe want to give Vidyo.io a try, it's very easy to go ahead and get signed up. So, just go to Vidyo.io, sign up for an account, no credit cards needed. Every account comes with an initial 4,000 minutes to get started, and you'll be able to go there and access the SDKs and the APIs and get started right away. Makes it very, very easy to start building, and you can start doing some proof of concepts and prototypes and see if Vidyo.io might be the right fit for your application. And one note, we will be having another webinar coming up on August 10th. So for any developers that are out there, we're going to be focusing this on specifically around developing custom layouts using the Vidyo.io platform. That's going to be presented by our developer evangelist, Sachin Hegde. So feel free to join us for that webinar if you're interested in learning more about sort of the intricacies of the API itself and how to customize the look and feel and those different layout options. And with that, I'm going to open it up for questions now, and I can see we've had a number of them come in. So why don't we just dive right in. Dan Coley, are you ready for questions?
Absolutely.
Yep.
All right. So the first one here I have is, how long did it take you to integrate the video chat APIs into your app?
Yes, so that process took about 2 months. And so we have one dev at the time who was doing front end, web, back end, and the iOS app. And so that's not a true representation of how quickly it could be done if you have one engineer focusing solely on the integration. But it took us a little less than 2 months to fully integrate, test, and push to production.
Okay, excellent. Here's another question. Are you planning on launching outside the US? Is English the only language supported on your app?
So we actually are absolutely planning on launching outside of the US, and that's the impetus on building some of these self-help programs, is that we're no longer going to be attached to the regulations of providing access just in states that we have clinicians. And so we will be expanding internationally in terms of English being the only language that we support now. The answer is no. So for folks that want to speak to clinicians within the states that we have clinicians licensed in, we have folks that speak Spanish and Mandarin. Yes.
Yeah, and so as we build out our clinical team, that's something that we've prioritized, is really being finding therapists who are able to treat clients in their native language. So right now, while we're only able to do that in the United States, we're already doing all of our homework to figure out how to expand as quickly as we can.
So kind of related to that question, are there any regulatory issues when you're providing services from state to state that you have to deal with?
Yes. So that's why there's totally a lot of that. So that's why we're currently only operating in 7 states. So the way that licensure works is that you are only able to treat clients within the state that you're licensed in. And this is something that we've really thought very hard about as a therapist. I think Dan and I make a really good team because there's a lot of things that make great business sense that they would really put our therapist license at peril. And so we've thought that through in a bunch of different ways. And so currently the therapists that we have only will treat clients that live within their state. And we use geofencing to really make sure that we're following those protocols.
And it's still a great opportunity for the clinicians because, you know, these regulations don't exist just for telehealth platforms. This is the state licensure regulation for folks offline as well. But in the offline model, realistically, you can't treat someone in San Francisco if you live in San Diego. That's not feasible. But through a telehealth platform, you absolutely can, and it's completely within the scope of your license.
Very cool. How do the therapists access the service? Is it also through a mobile app, or do they have some different interface?
Yeah, so we've built what we call the Frame, which is an EHR system, and that's how our therapists access the clients, and it is from a desktop.
Okay. How do you handle data encryption?
Yes, and so we have a BAA with AWS to make sure that we're storing all PHI at the proper level of encryption at rest and in transit. And so that's how we're managing data encryption.
All right. Let's see here. What was the biggest step to improve conversion?
Great question. And so I would say there were 2 bottlenecks. And so the first and it was an assumption that we had from the beginning, but we definitely had to test it, was the matching process. And so we didn't know that, trying to match clinicians with patients would actually work. We had to do our homework and make sure that we were recruiting a diverse clinical team so that we could treat a diverse population of patients. But it ended up being extremely fruitful for us and working really, really well. And it's really the core that all kind of double opt-in systems kind of hinge off of. And so there's just a higher likelihood when we have information from our clinicians about the type of patients that they want to treat, as well as having information from the patients within the type of clinician they want to work with. And so by having those two data sets of information, we can actually end up matching clinicians and patients pretty well. And so that was the first kind of trigger that lifted conversion significantly. The second was digging in and really understanding that not all individuals that download our app are ready to speak to a therapist. And so the conversions from download to sign up through the first intake chat were very high, but we saw a significant drop off after the intake process and booking the free 20-minute consultation. And so that didn't make that much sense to us at first glance, because it's a free 20-minute consultation. People had already gone through a chat with an individual to give information about what they're experiencing and the preferences they have. So why not book a 20-minute consultation? And so that's what we did a lot of research around at the beginning of this year, and understood that a lot of folks just aren't ready to speak to a person at all. And so we had to give them some more information. It's psychoeducation. We had to give them some more information about what to expect, a little more information about anxiety, depression, and access to some assessments so they can at the very least quantify kind of what they're feeling. They just know something is off. They don't really know to what degree or how to talk about it or to quantify it. And so we had to give them tools to be able to do that. And so we suspect that that will be another kind of bottleneck that we'll be able to address and lift conversion significantly.
Okay. Here's another question. Could you shed some more light on the cost pain point that you address? If I have insurance, I don't even know if therapy is covered. Does the app help me answer that?
Yeah, so I think we can both speak to this. You can speak to where we're headed, but currently in the United States, the average cost of a therapy session is $150. And so of course, if you're in a big city, that's even higher. And if you're in a rural area, there might not even be a therapist to access. So the first way that we've addressed the price point is by offering sessions, a 50-minute session at $99, which is significantly lower, obviously, than the national average. The other piece is, of course, working with employers to be able to have these services be reimbursed or be covered by insurance. And do you want to talk about the other pieces?
Yeah, and we also accept HSA and FSA accounts, and so it's tax deductible. Obviously not the same as going through insurance, but that's an option and something that we have built into the platform. Additionally, we are working with some hospital networks and very large hospital networks in the near future to be able to accept insurance directly through the platform. And so that will allow us to provide eligibility insight, so you can get a sense of how much coverage you have available specifically for mental health. And, you know, as you're reaching certain thresholds within your account as well. Lastly, depending on if the patient is an employee of one of our partners, they will get access to either subsidized sessions. For example, we are partnered with Teach for America. And so Teach for America teachers, when they access sessions, they pay a fraction of the price just because Teach for America subsidizes those sessions. Otherwise, if you're an employee of a self-insured employer, which we also work with, let's use, this is not true, but let's use Quicken Loans for an example. We would be able to provide the data points to Quicken Loans to submit the claim for reimbursement. So the employee would only have to pay their copay within the app.
And I think too, this question is really great because it highlights how difficult it is to navigate the system of mental health treatment. And so to not even know if therapy is covered in your benefits package is really common. And so we're really working to address that head on, because if you imagine kind of the wherewithal it takes to really take a brave step and reach out and ask for this sort of support, and then to be met with navigating a system that's really convoluted, it's hard to keep that momentum. And so we're looking at all those different pieces to really streamline the process and make sure people can get the support that they need at whatever level that is. pretty immediately.
Here, this is I guess a feature question. Do you support an overlay experience in the app so you can navigate around the rest of the app while keeping a small video panel overlaid on top?
We theoretically, yes, we could do that. We have focused on making sure that individuals are engaged in the sessions. And so we actually have visually designed a UI that actually has a frame. And so it actually acts as a, you'll be able to speak to this, actually as a visual container, but theoretically it actually contains the conversations as well. And Chloe can elaborate on that. But again, the point when individuals are in session is to be in session.
Yeah. So one thing that part of our hypothesis and that we've leaned into when it comes to working with the therapist is that real sustainable change happens through the relationship that you have with your therapist. That's why matching you with a therapist that's a good fit is so important. I mean, it really drives the clinical work. And so we've taken extra measures to really contain that process. And so at this point, while I think it's potentially very beneficial for a therapist to, at the beginning or end of the session, be able to have that overlay to help the client or the user to understand some of the tools that are available. It's something we're looking into, but as far as containing the experience, that's our priority at the moment.
Makes sense.
Mm-hmm.
Here's another question. Do you have plans for an Android or desktop versions?
Yes, and Android is at the top of that list over a web app. And so that is something that we are already working on for sure. We recognize that is not, it's not ideal to not have a mobile app on Android, but more importantly for international expansion, that's going to be crucial.
Okay. Another question, will the session be available afterwards? I can answer that one. Yes, we're recording the session. So after we're done, about 24 to 48 hours, we'll make the recording available. And we'll send an email out to everyone who's attended or signed up so they can either watch it again or share it with someone else who might be interested in catching the session.
So I just want to make sure that we're answering the question. I'm not sure if they're talking about this webinar or if they're talking about the clinical session.
Yeah.
So Ben, thank you for making that clear that this will be available via email. However, because of limitations around confidentiality and how ethically and legally therapists, the note-taking process works and the clinical record is held, you will not be able to replay your session.
That's a really good catch, Chloe. I was thinking about it in terms of the webinar. I wasn't thinking about it in terms of the clinical session. Yeah. Thank you for making that clear.
Yeah.
That's a very good point. Let's see. Some really good questions coming in here.
Really?
Trying to find an interesting one here. Here's, does the platform support on-demand consultations? Or is it a scheduled consultation?
So you do have to schedule, but you can schedule same day. We just buffer the schedule from the initial session by 12 hours. So we want to respect the clinician's time. So you can only book at a minimum 12 hours out.
Okay. Question for me, it looks like, any sense for the amount of telehealth use cases that have been developed on Vidyo.io so far? So Vidyo.io is actually used in a variety of different use cases. We're seeing really at-home type of telehealth applications. We're also seeing integrations into EMR platforms where a specialist or a primary care physician can have a follow-up consultation with patients so that they don't have to come back to the office just to have the follow-up session. So we're seeing a variety of different use cases. There's a lot of them that are currently being developed right now. So I'm really excited to see over the coming months what other types of telehealth applications are going to be built on Vidyo.io. Here's another question. Have you considered crisis services through the app?
Yep, that's a great question. And I was kind of thinking too through the answer around the on-demand aspect is that it's really important to hold in mind that we're not an emergency service. And we're not equipped to be an emergency service. And we really draw that line very hard. So we've built features into the app so that we are able to deploy emergency services in a worst case scenario. And while we do have therapists who are very capable of helping to mediate crisis, we can't be a crisis line. So in those events, we've made it really convenient for the user to be able to access crisis lines, and as well as our therapists, so that both therapist and user have tools at their disposal to access appropriate services in those circumstances.
I have another interesting question here. You mentioned how matching contributes to stickiness. Can you shed some light on how you gained that insight?
Yeah, it was an assumption that we tested out very, very early on. And so I spoke a little bit about it earlier about having insight around kind of the root of double opt-in systems and why they work so well. And so that was the impetus of building that within this application. And it wasn't just insight around kind of those systems and how they operate. Anecdotally, it was something that I experienced. And so when I was looking for a therapist, I had to buy a bundle of sessions before I spoke to anyone, and was just, shown a directory and had to choose. And it ended up not being a fit. And so immediately I thought of solutions around how this could be better and a much better experience. And for some reason, that was one that just jumped out. And so we tried it out, and it ended up being something that led to significant engagement on the other side of the free 20-minute consultation. So again, for folks that, go through the intake process, book a 20-minute consultation, a very high percentage of those convert to paid sessions. And a very high percentage of those individuals tend to book subsequent sessions as well. And so that lets us know that we're doing a good job of matching clinicians with patients.
Excellent. All right, I think we have time here for one more question. Here's one therapist refer someone to another therapist if there's a certain level of expertise that's required.
Yep, absolutely. So our therapists, again, something I've really focused on in my role is building a community of therapists. And so I'm available for consultation at any time. And so there have been cases where, for example, a client was in need of very consistent services, and the therapist had a vacation planned, right? Something as simple as that. So that therapist contacted me, we consulted, and together we developed a plan so that the client would be seen even in the therapist's absence. So absolutely, that's something that we look at, we take very seriously, and we really support our therapists in making sure that they have access to the tools they need to appropriately treat the client.
All right. And with that, I think we'll wrap here. Dan, Coley, thank you so much for your time. I really appreciate it. This was very, very interesting. Super cool to see your app and your service. Really, really neat to see how it's helping people.
Thank you.
Thanks.
Thanks for the time.
And everyone else, as I mentioned earlier, we did record the webinar session. And that will be made available in approximately 24 to 48 hours. We'll send out an email notification so that you can watch the session again. And we thank you all for joining. Have a great day.
Thank you.